Hello, my name is Faustina and this is my student ID.
Good.
So I'll be doing my VAX assessment and I'm going to administer an SA draft. Thank you. Alright. Hello, my name is Faustina AD. I'll be the student nurse administering your medication today. I've read through your chart and doctor has prescribed morphine hydrochloride to be given to you. But before I do that, I would like to ask some few questions before we continue. Is that okay with you?
Yeah, that's okay.
All right. Can you please tell me your full name and date of birth?
My full name is Ken Dawson. Date of birth is the 31st of March 1984.
Dobson Kane, 31st of March 1994. MRN is 0956740. 0956740. So Mr. Thompson, please, do you have any allergy?
Yes.
What are you allergic to?
Penicillin and face swell every time I take it.
Oh, so it's just face swelling, but today we'll not be giving you penicillin, we'll give you morphine. Mr. Dobson, please, do you have any pain?
Yeah, I do. I do have a chest pain. Every time I breathe, it's really painful.
Oh, okay.
Yeah.
So, please, I'd like to ask you, whereby 0 means no pain and 10 means extreme pain. So, rating your pain from 0 to 10, what is your rate?
It's 6.
6.
Yeah.
Okay. And does the pain transfer anywhere or just one side?
Just one side.
Just one side.
Yeah.
Okay. All right. Thank you, Mr. Thompson. I'll get your medication ready and then I'll be right back. This is the buzzer. I'll be back soon with your medication.
Okay, thank you.
So please I'll need my nurse to validate my order. Now I'll validate my order.
Yeah. What is that?
So we have Kane Thompson, 31st of March 1994, allergic to penicillin, face gets swollen. So we have the right patient. Doctor has prescribed morphine hydrochloride citrate. So we have the right drug and it's supposed to be given today. We have the right date. The time is supposed to be given now. We have the right time. Doctor has started 15 mg 624 hourly. We have the right dose. Patient has rated his pain score as 6 out of 10. All vital signs have been taken and are within the normal range, and it has not been given yet. Doctor has printed his name and site, so we have a valid order. Are you happy?
I'm happy with that.
All right, thank you.
The dose is
So now we'll go to the medication
only every 4 hours.
cupboard to have my first medication check. Thank you.
4 hours. And for our patient, it's 15 minutes.
You're okay. How come I took over your assignment? How come I took over your job?
Because I was going on my So before we have my first medication check, I'll just go through the means. So looking at my means, I have morphine and it's an opioid and it's used to relieve pain as well. It works on the central nervous system and also acts to reduce pain. The normal maximum dose is 5 to 20. Doctor has charted 15, so I'm happy with the dosage. With the effect, sometimes you have low respiratory rate, low blood pressure, and also you might have nausea and vomiting or dizziness. So we have to be very careful. It is not recommended for people who have asthma, COPD, and renal failure. And even though if we give it to them, we have to make sure that we monitor them as well. And also, after giving it, what you have to do is you make sure we continue to monitor them. Thank you. Now I have my first drug check. Can you please come and check with me? I have Ken Thompson, 31st of March 1994. Allergic to penicillin, face gets swollen. Patient has stated pain is 6 out of 10. All vital signs have been taken and are within the normal range. Do I have the right patient? Doctor has prescribed morphine hydrochloride. I have morphine hydrochloride. It comes in 5G in a ml and it expires on the 12th of 26. I have 15 mils here. Doctor has prescribed 15 mg 6 to 24 hourly. So I have the right dose. It's supposed to be given today, so I have the right date. It's supposed to be given oral route, which I'm going to be giving. The time is supposed to be given now, so I have the right time. Doctor has printed his name and sign, and it has not been given yet. So that's my first medication check. All right, so I'll do my calculation. So I've done my calculation. I'm going to give 3 meals. So I'll draw my.
Yeah, you didn't wait for us to start recording. You just started speaking. So yeah, so every time I had to say, okay, wait, to start with.
That's right.
Yeah.
I'll just have the criteria. Only for people who like
So I have my second medication check. I have Ken Johnson, 31st of March 1994. Allergic to penicillin. Face gets swollen. So patient has taken 26 out of 10. All vital signs have been taken and are within the normal range. So I have the right patient. The doctor has prescribed morphine hydrochloride. We have morphine. It comes in 500 in a meal. And it expires on the 12th of 26. I have 50 mils here. So I have the right drug. Doctor has prescribed the dose 15 mg 6 to 24 hourly. So I have the right dose. The route is supposed to be given is oral. I'm going to give it oral. I have the right route. Time is supposed to be given now. I have the right time. It's supposed to be given today. I have the right date. The doctor has printed his name and sign. And I have done my calculation. I have 15 meals here. I've taken 3 meals. I'm left with 47 meals. So doctor has written his name and sign, and it has not been given yet. And this is my 3 meals. That's my second medication check. So now I'll just have my last drug check before we go to the patient. Again, we have Ken Thompson, 31st of March 1994. He's allergic to penicillin. Face gets swollen. We have the right patient. Doctor has prescribed morphine hydrochloride. Morphine hydrochloride. It comes in 5 mg in a ml. And right now I have 50 mils, but I took 3 mils out, so now I have 47
mils left. Yeah.
So doctor has prescribed that, and it's not expired. It expires on the 12th of 26.
Hold on to.
And we have the right drug. The time is supposed to be given today, so we have the right date. The time is supposed to be given is now, so we have the right time now. Patient has stated his pain is 6 out of 10, and all vital signs have been taken and are within the normal range. and I have done my calculation. I'm supposed to give 3 meals, and I have got the 3 meals down, and you have checked and you are happy with it.
Yeah.
Are you happy with that?
happy with
Doctor has printed his name and it has not been given yet,
Yeah.
and have been signed.
Okay.
Thank you. So can you please fill this out for me before we go?
Yeah.
I'll just fill this out before we go.
How would I take the cap off?
How would you take the We had a bottle with no cap in the morning, so the tutor brought us a new bottle with a cap.
We'll put that in our hand Yeah.
Just left to do patient shot.
You're gonna put the syringe like this, right? And then draw it up. I just want to ask you, can I still use this paper? I've made an error. Can I still use it for assessment?
So what would you do?
Asterisk and write with an error?
Exactly. So the way you will write error is asterisk, and you have it because you do not want, because as you progress through the sheet, you have multiple errors. So you put an asterisk 1, and then you will write the date and time that will correspond to that error. So example of date and time, that is it. That's an error code.
We're not filling that one, that's pharmacy, is it?
No, you fill it because when you receive from pharmacy, you go received from pharmacy or received forward from another drug item, you will not receive from another drug. So see, this is and again, this item is all from pharmacy. So in this case, it's an error of asterisk, and then you did and run it as a code of an error, and then how do you write the error?
Okay, so now we'll go to the patient, and then I'll have my second patient check, and I'll give the medication. Before we go, I'll put the medication back. I'll make sure double check is closed. Hello, Mr. Thompson. I'm back again with your medication. But before I give it to you, I'd like to ask some few details before I give it to you. Is that okay with you? Yes. Okay. So can you please tell me your full name and your date of birth?
My full name is Ken Dobson. Date of birth is 31st of March 1994.
Ken Dobson, 31st of March 1994. MRN 095674. 095674. Mr. Dobson, are you allergic to anything?
Yes, I'm allergic to penicillin.
Penicillin. What happens when you take penicillin?
I think that's all.
Okay. Today we'll be giving you morphine. We won't give you penicillin. Okay, so before I give you the medication, there are some things I want to let you know. So if I give you the medication, it come out that maybe you might feel nausea and vomiting, you might feel dizzy as well, and you might also have a low respiratory rate or a low blood pressure. It is normal, but it's something that happens when you take morphine. Are you still happy to take it?
Yeah, sure.
Okay, all right, Mr. Thompson. So I'll just give you, I'll lift you up and just give you your medication. Yeah, have your medication, and you can have some water to help you push the medication down to your stomach. And are you comfortable sitting like this? Or you want me to bring the bed back?
I'm comfortable like that.
Okay, all right. Mr. Thompson, because I've given you, I told you the medication sometimes you feel dizzy, so I recommend if maybe you stay back in bed, you don't get up too much, so that you will not have a risk of falling. So for now, just like you to stay back in bed and feel relaxed. Okay, I'll come back in 5 to 15 minutes to check how you are doing and to take your vital signs again and to check your pain score. Okay, if you need anything else, just press the buzzer and I'll get back to you. Thank you. So can you please help me as we sign the application chat? So the time is
So this medication
I have to watch mine to figure out if there's anything. Let me watch it.
okay. Thank you. You're welcome. I'll wash my hands.